Hey there, Whitney.
Hi.
Okay, what we're going to do is we're going to do an orthotic scan today. It's going to check for pronation, or if the feet are angled and how that may affect the ankles, the knees, the hips, the pelvis, and then how it even affects the spine in general as well, and if there's a need for spinal pelvic stabilizers. So what we're going to do first, we're going to have you stand onto the scanner here.
Okay.
We're going to put your right foot right on the glass on the window.
Right here?
And left foot right to the side, yeah.
Okay.
And what it's going to do first is there's going to be a little laser, and the laser's going through right now. We can see. The laser's going to check for topography and the depth of the arches. And the second scan is going to come through, and it's going to tell us the pressure and sensitivity on the bottom of the feet and where you're actually standing, and if there's pronation or supination, where the arches are dropped as well. And then it's going to calculate that, and then we're going to switch to the other foot in just a second. Okay. So we're going to put your left foot right on the window now, and the right foot to the side. And now again, it's doing the same thing. The laser is coming through and it's checking the topography, which is the depth of the arches. We have 3 arches in the foot. We want to make sure that we maintain them all. If one's maintained and another's not, that means the foot is everted or inverted, it's pronating or supinating, and that can affect, again, the feet, foot pain, but then also can travel right up the kinetic chain to where we have ankle, knees, hips, pelvis, or even spine can be affected when not properly stabilized. So what we see here with the scan, on this side we see what a normal sample would look like, and over here we see what our patient's actual scan looks like. So what we see with the normal, the red is the most amount of pressure, then yellow, and then green, and then blue. So we see in this area here on the ball of the foot we should have a lot of pressure. Same thing down here at the heel. We have 3 arches here, this lateral arch, this medial arch, and then the transverse longitudinal arch through here. And where we have that, we call that the plantar vault. And where that vault is, we should have very little pressure. There's 3 arches there to support. And so we could see with hers, and we'll turn it into color in a second, we're going to see that she's missing the lateral arch, or the outside of it. Her medial arch is intact, but the lateral arch is missing, meaning she's pronating the feet. And with that, we can see actually what it's doing to her pelvis. We can see that it's tilting the pelvis, it's torquing the ankle, rotating the knee in, torquing the pelvis this way, and dropping the shoulder on the opposite side down. So again, you can see here that these lateral arches are now missing here. We see still she's maintained some of the medial arch in the green area here, but you see even at the toes, excess pressure past the ball of the foot to the toe, and then this whole outside arch here. We're going to see now as it's going to turn, we're going to see what it looks like on the outside. And we're going to torque some of these angles so you can see exactly what her scan looked like. This is the posterior, the back of the foot. We're seeing the actual heel itself here. And this is going to show us, we're going to look at the actual arches. And what we can see with hers is that her 2 arches, even though she does have some medial arch, the 2 arches are actually different. So you can see as I'm pointing the mouse here, the one arch on one side is a little lower, this one's a little deeper. So she's walking on 2 different feet, and what that's doing, that throws the whole pelvis out of alignment. That changes up the kinetic chain. So from the ankles to the knees to the hips to the pelvis, throughout the kinetic chain is different. So as we turn them to the side here, we're going to see, look at the actual arches themselves here. They're different from side to side, so it's affecting everything. So she would be a great candidate for spinal pelvic stabilizers, and what those would do is help her hold her adjustments better and support everything from the bottom of the kinetic chain up. You can see here there's a significant amount of force that enters in the heel strike, moves up the kinetic chain to the knee, to the hip, and up to the spine, and literally still 10% of the total force from that heel strike is actually still hitting her right in the neck. And so it's actually contributing to some of the problems she has with her neck, middle back, and lower back as well, not only pain on the bottom of the feet or the plantar fascia. So we do use these products to go along with our chiropractic care, again, to help people hold their adjustments and help just support the arches and prevent injury, prevent ankle injuries, foot injuries, knee injuries, hips, and even spinal injuries as well.
So I'm Dr. Neil Rodnick. Dr. Adam asked me today to come in and show you the kinesiotaping for foot arches. And what these are going to do is actually, it's similar to the foot leveler thing, only a little bit more of a gentle way of doing it. And we're going to put 2 pieces of tape per foot here, and it's actually going to bring the 3 arches back a little bit. And this kinesio tape can be used all over different joints in the body as well. It's either used for stretching or for tightening up muscles and ligaments and kind of adding some more support. Bring your foot toward me. So what we're going to do here, this first one we're going to tape across the metatarsal heads. And we actually leave it nice and loose, and then we kind of stretch the top part and bring the bottom together a little bit. And the second piece we're going to bring in and go straight across the navicular bone. And same thing, going nice and loose, and then we're going to tighten it up at the bottom and stretch the top. Do both feet. And with the soft kinesio style tape, when you do these, you really won't be able to tell anything's happening at all until you're standing up moving around on it. And then you'll actually feel it pulling the arches in a little bit. And that's it. So the 2 pieces of tape are going to kind of bring back some of the lateral arch, the medial arch, and the transverse arch into the foot. So now I'll show you what stabilizing orthotics actually look like. So if we decide to incorporate these in your care, we'll show you what they look like and what their purpose is and what they do. So here, this is a 3/4 length. And what I like about this particular company, or this particular brand that we use here in our office, is that we can customize it to some degree based on the type of shoes you wear the most, and the type of activity level that you do the most as well. So you can see that this particular one is 3/4 length. It's not quite as long. It's not going to go the full shoe length here. And you see this type of a material here is best for, let's say, dress shoes. You know, it's not too hard, not too soft. If you feel it, it's got a little bit of a give to it. Yeah. And what this does differently than, let's say, an over-the-counter orthotic that you may find at a local drugstore or a sports store or something like that, is most of those only support one arch. What these do, because again they're custom, it's going to go based off the scan that we did with the laser. Here, it's going to send it right to the lab electronically. The lab will use that to make a mold and make a custom orthosis for you. And it helps support the entire plantar vault, which is 3 arches. Again, the medial arch, the lateral arch, and the transverse longitudinal arch. And it supports that whole vault, which that whole vault actually supports your whole framework, your whole structure, all the way up and down. Again, from your feet to the knees to pelvis, up through the spine as well. So it supports a lot more bones and joints than you would actually think, because you're constantly standing on it. We need that full proper support to stabilize the pelvis and the whole body. So again, this is a 3/4 length. If you wear a lot of high heels, we can make it a little thinner. You can see the thinner ones here. We could put a Velcro strip in it like this so that it sits into a high heel. They make it custom for a 1-inch or a 2-inch high heel. This type of material here is more waterproof, a little harder, more durable. A lot of the times firefighters, somebody's on their feet all the time, need more toughness to it. We'll use that. And this one we have like a sweat absorbent material here, and the sweat absorbent material is more custom towards athletic shoes, working out, things like that. It's got sweat absorbent and moisture wicking, things like that as well. There's a few other things we can do to make it more customized. Let's say you had a heel spur, we can put a little cup in there to avoid putting pressure on the heel spur at all, or sorts of things like that, to make it a little more softer on the impact, on the heel strike as well, things like that. So I'll give you a little pamphlet just kind of going over the difference between a custom spinal pelvic stabilizer or just an over-the-counter insert that someone may find, at the checkout counter at Walmart. So you can take that with you and let us know so we can customize something that will also help your hold a little better and help things stay a little longer for you, spine and pelvis-wise as well.